for watching this edition of On the Move with Lady Kate. What a beautiful day to introduce a very special person, a Cameroonian American who is highly successful in the medical profession. He is also a successful businessman. He is the director and founder of Richard Medical Academy, which is based in Toledo, Ohio. Ladies and gentlemen, I'm honored to introduce Dr. Takang Abunaw. I am here with Dr. Takang Abunaw. How are you?
I'm wonderful. How are you?
Awesome, awesome.
Great.
I'm doing great. And thank you for coming to the show. And we're here to talk about the Richard Medical Institute. But first, I want you to tell us a little bit about your background so my audience can know more about you.
Good. My name is Takang Abunaw. I am Cameroonian American. I was born in a little town in Cameroon known as Kumba so many years back.
Okay.
And moved, went to St. Joseph's College, Sase, for 7 years.
Oh, wow, you're so bad.
Right. Then went to medical school, finished medical school. Moved to the U.S., did my postgraduate in epidemiology, that's public health, in University of Toledo in Ohio, and saw an opportunity for the need of nurses and healthcare, and started a great company known as Richard Group of Companies, which Richard Medical Academy is one of them. That was started about, the main group of companies was started about 10 years ago.
Okay.
Right.
So you've been in business for quite some time.
Right, about 13 years.
And also given your background in the medical field, mostly public health.
Right.
I know you have a very successful professional career.
Right.
But the good thing about what you're doing is that your success is not only to yourself.
Right.
You want to see others succeed in life.
Right.
That's amazing. So you established the Richard Medical Academy.
Right.
Yeah, that is excellent. And I just want to introduce our chat with a little quote from President Obama. America is not a place where chance of birth or circumstance should decide your destiny. And that is why we need to build new ladders of opportunity into the middle class for all those who are willing to climb it.
Correct.
And education is a step into that middle class. By gaining your education, you put yourself on another level to compete in the world of jobs and opportunities.
Right.
So you founded the Richard Medical Academy. Can you tell us about the programs that the school is offering?
Right now, what the state of Ohio has approved for the school is to offer licensed practical nursing, which we started in 2013.
Right.
We graduated the first batch in 2014. We had a small class, about 14 students, about 6 students. Then in 2015, we graduated about 20 students.
Okay.
We have a much bigger class now. What we did when the school was just approved by the Board of Nursing was to run a class each year, to test run and see how it's going to work.
Right.
Now we've decided to run 4 classes a year.
Oh, wow.
Yes, we've decided to run 4 classes a year, and the program that we're running right now is the Licensed Practical Nursing Program.
Okay.
We have the RN program, which is in the works. With the Board of Nursing trying to get approved and stuff like that.
Okay, that's very good. So right now your LPN program is up and running.
Right.
And you've actually graduated some students.
Right.
That's excellent. But what are the requirements to get into the LPN program?
The requirements stipulated by the Board of Nursing in Ohio for you to get into that program is you have to at least have a high school diploma or a GED. It doesn't matter where you got a high school diploma or GED, you can have it in Africa, wherever in the world.
Right.
Insofar as you have the equivalent of what is required in the USA as high school diploma.
Right.
And you have to be able to pass a background check because you'll be dealing with people, so we want to make sure that you don't have any criminal records and things like that.
That's right.
Right. You have to have your CNA certification certified nursing assistant certification.
Okay.
Then we'll do a physical exam for you. We have doctors and staff that will do a physical for you.
Right.
To make sure you are able to do whatever is required for you to do as a nurse.
Okay.
Basically, those are some of the requirements that we need. And finally, you have to pass an entrance exam. There's a basic exam that we want to know if you are able to comprehend the material that will be taught to you in class.
Okay.
The entrance exam that we do right now is known as HESI, H-E-S-I, entrance exam.
Okay.
So you need to have a minimum of 79% for you to get into that our program.
Right. So let's go back to before a student actually is able to enroll. I know a lot of your students, I've learned from the backgrounds, they're from different African immigrant communities.
Right.
Say someone just came from, say, Nigeria.
Right. And
they have their certificates from there.
Right.
Do you actually help them to get that equivalent?
Right.
To the GED? What is the process?
When you come into, when you find out about the school and you call our school, we have some very talented reps that will talk to you about the program that we have.
Right.
And depending on where you're coming from, we will be able to evaluate your results and tell you if you have the equivalent of what they call the GED here and or high school diploma, so we can enroll you in the program. Right. We can also send you to external sources for you to get your results evaluated so that we can accept you in the program.
That's brilliant. So anyone calling, they know they can have some assistance in getting started.
Right.
That's beautiful. So say you've met the requirements. Are there any prerequisite courses? I know going into RN programs, they require some prerequisites. Do you have anything like English 101 for someone who whose English is not the first language to them?
No.
Do you have any requirements like that?
No, we do not. We do not have those requirements. We insofar as you have your high school diploma and the other requirements which I mentioned earlier in the program, you can actually get into the program. We have very, very skilled staff. Our staff are very, very skilled with making sure that you can comprehend the material going forward.
Okay.
Right.
And I know the school is based in Ohio.
Right.
And you live in Ohio yourself.
Right.
What are some of the attractions in Ohio that, you know, can draw students to come to your school? Because for someone to leave Georgia or Maryland and go over to Ohio, what are some of the benefits, the attractions? I mean, is it cheaper to live there? What is the cost of living?
We are in Toledo, Ohio, which is a very, very beautiful place. You must have heard over the news and everything. Beautiful place. The attractions that you find, it's a very quiet, nice city where you can easily come in, adapt, study, get a job. And it's very, very inexpensive to live in Ohio. We have apartments which you can live and for a very nominal fee. And you can always have a job and move on with your life. Okay.
It's good to hear that the cost of living is cheaper.
Right.
That as a student you can actually have an apartment. You can find a job locally.
Right.
Because I know you got to pay the fees. So do you actually recommend, do you have recommendations? Say someone moves in, would you help them find an apartment? Would you recommend them for jobs? You know the places that are hiring.
Right.
Do you have any resource like that?
Right. We do have a permanent person on our staff that helps the students with all the resources that they need.
Okay.
When you come to the office, they'll be able to meet with you and see what your needs are. Do you need a job? Do you need, whilst you're going to school? Do you need an apartment? Do you need daycare for your kids? We have somebody that will handle that for you and make sure you get everything that you need for you to be able to concentrate and study. It's a short program, just a year, 12 months program. It's a fast-track program that will actually change your life if you're able to do it. So we want to help you as much as possible to make sure you can go through that program with ease, as much ease as possible.
So these are some of the attractions that I think we should highlight more, because usually students have a challenge of, number one, paying the fees.
Right.
And then if they're going to school, how intense is the program? Do they have time to, pick up a part-time job, to help pay for the tuition? And you're saying that this is all possible, and your staff are very talented and they have the resources to help the students.
Definitely,
Yeah.
definitely. Just like I said, I have the company that has Richard Health System, Richard Medical Academy is known as Richard Health System.
Right.
It's a much bigger company, and we are one of the biggest home healthcare companies in Toledo, Ohio.
Right.
So instantly we can get you a job.
Oh, wow.
You can work with us instantly.
That's amazing.
And we have somebody that will actually help you in making sure what is the best fit for you.
Yeah.
The classes are only Monday through Thursday from 8 to 4 p.m.
Yeah.
So you have Friday, Saturday, and Sunday that if you want to work.
That's good.
The apartments that we have, you don't even need a car.
Right.
It's about 3-4 minutes walk.
Right.
To the apartments, to the classroom. And new campus that we just finished building. As a matter of fact, we're moving in there in April next month. We just finished building a brand new campus.
Right.
And it's just another 3-4 minutes walk to the apartments that are right by the side of the school.
Yeah.
Right.
I think that's very good to point out, because if you're moving from a different state and coming in, you want to look at your costs, what it takes to keep you there for that 12-month period to go through the training.
Right.
So you're saying that it's a walking distance to your classroom, and it's very affordable.
Right.
The apartments are very affordable. Do you find that students actually share rooms or share apartments? And that makes it even cheaper.
Right.
Yeah.
Students are able to share an apartment for maybe about $200 a month each.
Wow.
Yes.
Wow.
Compared
That's
to other
amazing.
places like DC and stuff where
it's very costly.
Very, very costly to live.
Very costly.
And it gives you that peace of mind that you're able to go through the program.
Right.
Yeah.
Oh, that's amazing. And then another point I would like us to touch on, I think you mentioned briefly, how intensive is the program? I know you said Monday through Thursday. Does that just involve classroom, or does that involve clinicals? How do you balance the two to give the students a chance to get some experience before they graduate?
Good. The program, as I said, it's a Monday. The way it was approved by the Board of Nursing in Ohio, it's Monday through Thursday from 8 to 4 p.m. Thursdays are mostly reserved for clinicals.
Right.
So clinical hours are Thursdays. So we do not do any clinicals on Friday, Saturday, or Sunday. So everything is within that period between Monday through Thursday.
Right.
Right.
Okay.
So you have your class hours, Monday, Tuesday, and Wednesday. Clinicals mostly on Thursdays in the local hospitals or nursing homes and doctors' offices around the area. Right.
Okay, that's good. It gives, enough flexibility. Yeah. Okay, and like everything, every new career that you jump into, it involves, cost, tuition fees. Can you share how affordable this program is compared to other programs that are offered around the country? What will make someone, board that flight and say, hey, I'm going to Ohio to Richard Medical Academy?
The cost of our tuition for the program for the whole year is $9,215. Compared to other programs even in Ohio, which goes to close to about $30,000.
Wow.
You have $9,215 for your tuition.
Right.
Then you have books and lab fees. That brings the total cost of the program for the whole year to about $14,000. $14,000, we make payment plans with the students.
Right.
We make payment plans with the students, which are very, very flexible, depending on what you can afford.
Right.
Then we'll arrange something for you and make sure that it's not too stressful so that you can actually study, because the ultimate goal that we have is that by the time you're done with the one-year program, you can pass your NCLEX.
Oh.
That is the goal.
Yeah.
And that's the provision that we have.
Yeah.
So we'll work out a payment plan with you if you're not able to pay the $14,000 up front. We work out a payment plan with you so that you can actually afford and go through school seamlessly.
Yeah, this is so amazing. I just want everybody who's watching to listen carefully. Not many schools will offer that payment plan that you're talking about, the installments, and also help you grab a job while you're there, and how affordable the housing is. I mean, this is like a gold mine. This is just, it's a treasure. It's very attractive, and I think, you know, anyone out there who's trying to get into the LPN program and hopefully progress to RN, BSN, should start from Richard Medical Academy. Just listen to all the benefits. I mean, it's amazing. Now let's talk about how you prepare your students for the board. I know spending a year in Ohio is beautiful. You go through this amazing program. At the end of the day, the students want to be able to pass the NCLEX and get that, you know, registration, that license. So how do you really prepare the students to make them successful?
We have a very wonderful program that we use. It's known as Evolve. Evolve is a program which the students start from day one. We start preparing for that NCLEX from day one. I borrowed this from my experience, the many schools that I've gone to. I noticed my success is dependent on the preparation which I had. And so when we got this program, we went around, we talked to so many different educators, and we use Evolve because Evolve has been training nurses for the past 80 years. And the success rate is so high. So from day one, we start using this program. We give you so many tests and assignments so that by the time you get to the first quarter, end of the first quarter, we can pretty much tell where you are. And if you're not doing so well, we should bring you in. We bring you in and we talk to you. We tell you the various areas that you're weak in. And this program gives you a very graphic analysis of what your areas of weakness, your areas of strength, where you need to put more effort, and so that you are successful in this 1 year that you're spending in Ohio. And we have every single student that has taken the board, that has gone through our school, has passed the board.
Oh my goodness.
Every single one. We have a student that called me from Lansing, Michigan. She's been in the U.S. for maybe 20 years. Had her kids, gone to school, not gone to school, but she said, you know what, it's time for me to go to school.
Think about yourself.
Think about yourself. She was a caterer, and she walked into the school. Somehow I was in the school on that day, and I talked to this lady, and she said, is it possible for somebody like me to become a nurse? I'm a caterer. I cook for people. When they have, she's from Nigeria. I cook and cater for events. Can I become a nurse? She's about 50 years old. And I said, this is possible. I gave her a book, the entrance exam book. She went, studied, came back, took the entrance exam and passed. She didn't believe herself. She said, can I do this? She came, started the program, passed the first quarter, second quarter, third quarter, passed the fourth quarter. She was the first person to pass the NCLEX in the school. She was the first person. She calls me almost every day now. Yes, she calls me almost every day. And it's just this kind of stories. It's just always been like this. We have another lady from Cameroon. She lives in Lansing, Michigan. Similar story. Similar story. And every single one of them that has gone through the program has been able to pass the NCLEX. And they call me every day and say, you know what, this has really changed my life. I never knew this is possible.
That's wonderful.
I never knew this is possible.
That's wonderful.
We make it possible for you.
So just what I want to say is that, you know, to everyone that's watching, you have to start by believing in yourself. We are going to share some success stories that Dr. Abunaw will share with us. But I just want to say that you have to start with yourself, believe in yourself. It doesn't matter what career you are in right now, but if you have a goal, you want to become a nurse, you want to become an LPN, you know, think that you can do it first. If you believe that, you're going to be successful. So I would like Dr. Abunaw to share with us some of the success stories. I know you told us about the Nigerian lady who was a caterer. That's an amazing story.
Right.
You know, and she was one of the first to pass her boards. Yeah. Do you have any other success stories you want to share with us?
Definitely. I have students coming all the way from Houston, Texas. 90% of our students right now come from Detroit, Michigan. Detroit, Michigan. They commute an hour every single morning to come to school. And it's just been amazing. They come to school, they study, and graduation day is just like all smiles, all smiles, all
That's
smiles.
Wonderful.
And you were asking me the process for them to pass their boards. We have a very impressive program that we use that has helped the students very much to be able to pass their boards, because some of them have not been in school for quite a while.
Right.
So as I tell you, every single one of them that comes in believing in themselves has made it true.
Right. Can I also ask you, what is the gender? Like, what's the gender percentage? Do you find more women coming into the program or men? Do you get some men, some guys coming in?
Yes. I would say it's about 90% of women and about 10% of men coming here.
Because as a healthcare professional myself, we are beginning to see more men, you know, guys are coming in. You know, traditionally nursing was really for women. But we're seeing more guys coming in now. So if you're out there, you're a guy, you're looking for a change in career, nursing offers the best opportunities. You know, you will always have a job.
Definitely.
Because people are always going to be sick. There's going to be hospitals, nursing homes. And so nursing is very, very lucrative area to look into. So guys are not, you know, denied access.
Definitely.
We have access to guys as well.
Definitely.
Yeah, so you said you see maybe 20%.
Yeah, about 10% of men. But right now it's increasing, because I got a call last week from a guy in Aurora, Illinois, somewhere on the outskirts of Chicago. He called me, he called me about 11 p.m. at night. And he said, you know what, I've been working in the factory and I'm tired. I've been in this country for about 20 years. Is it possible for me to come over there and become a nurse? I said, it's very possible. And we're making arrangements for this guy to come to start the next class.
That's wonderful.
You know, so he's making arrangements with his family to come over here. And it's a very rewarding career, very rewarding. It is. Very rewarding. And I mean, you put so much smile in people's faces, and financially, it's not that bad, you know. So if you can help somebody, why not? I think financially it's good when you're starting out in nursing. You have steps that you go if you don't want to go straight into like a BSN program. I've known nurses who started as healthcare assistants, and then they did the LPN program, and then progressed to RN. So starting out with LPN is very good. But you know, someone might be sitting there and thinking, oh my God, do they do maths? You know, statistics, you know, chemistry, all those subjects that, you know, if you're not very versed with science, you might be a little bit scared. What are some of the subjects that you teach in the school? There is medical math, of course, but it's very basic math. It's exactly, I will put it this way, when your child is sick, and you have a prescription for a particular medication that tells you that 1 teaspoon, or no, 1 tablespoon of, say, this particular medication. How many teaspoons are you going to supplement to make it a tablespoon? Those are the kind of little basic maths that they're going to teach you. These are practical things that you need to know. If, say, you're working in a hospital and they say, the doctor says 3 tablespoons, what does it mean? Does it mean 1 teaspoon? What does it mean? Or 1 tablespoon? Those are some of very, very basic things that you'll be taught. It's not like it's rocket science, though they're asking you to calculate some
strange equation.
Right.
Yeah.
Right.
So very simple, basic maths, basic calculations, you know, how to calculate your medications and stuff like that. So nothing to be scared about in the LPN program. And do you find that most of your students, after graduation, they want to actually move on to pursue an RN program? And what is your school doing to obtain, you know, accreditation to run RN programs?
Okay, great. It will be very amazing for you to know this. A lot of the students that come to our school, they might have careers in other fields. Or they might be nursing assistants. But when they come in and they register and they look at the environment and they attend the first class, the first question that they ask us is, when are you going to do the RN program? When are you going to start the BSN program? They want to go further. Every single one of them that I've seen, they want to go further.
That's good.
Unfortunately enough for them, we already have an answer for that. We have a program being looked at right now at the level of the Board of Nursing for the RN program. The transition LPN to RN program. So immediately that is approved, we should be able to offer that to the students. So that immediately they're done with their LPN program,
they can stay
on and do the RN program, which will be a transition program. They can just go ahead another year and do the RN program.
That's amazing.
So we have that already in the pipeline.
So I'm very happy to hear that, you know, in the nearest future, Richard Medical Academy will be running an RN program.
Definitely.
So we are on this LPN program and the success is just huge. We have heard about, you know, students coming in with very limited knowledge or background in nursing or healthcare, and they are succeeding. If you're thinking about going into an LPN program, it's affordable. You move to Ohio just for 1 year and take this course and get you on the move to your next step. So the students who have succeeded, I'm sure not all of them are from Ohio. And so have they been able to, you know, pass the board in their different states, or do they have to take the Ohio boards and then move from there? What happens after graduation?
After graduation, you take an exit exam. After that exit exam, we register you to take the board, the Ohio Board of Nursing.
Ohio Board.
You pass the Ohio Board, you can transfer your license to any state, or any of the 50 states.
That's wonderful.
You can transfer because Ohio Board is a part of the National Board of Nursing.
Of course.
So if you're certified in Ohio, you can transfer your license anywhere in the state.
Oh, that's wonderful.
Most of our students come from out of state. They come from out of state. So when they take their boards in Ohio, they don't necessarily need to take it in Ohio. They can take it anywhere in the state. But they'll take the Ohio board. Then after that, they can transfer it to whatever state they want to work at. A lot of them already have jobs before they finish the program because they were working in a particular nursing home or group home, and I learned that you are going to Richards. And when are you taking your boards? We have a job for you.
Oh, wow.
So they have a job waiting before they even take their boards.
Wow, that's amazing.
They already have a job waiting. So by the time they take their boards, they're pushing them. You know what? Transfer your license today. We want you to put you on the schedule tomorrow. So it's just a wonderful, wonderful thing that God has been able to bless us to be able to bless other people.
That is so amazing. That is so amazing. And so we want to share with the viewers how to reach out to Richard Medical Academy because I know there is somebody out there who is listening, who is like, we thank God for this information. So how can they reach Richard Medical Academy?
They can go on the web. They can go on the web and just type in www.rma, that's Richard Medical Academy RMALPN.com. Or call the school directly at 419-534-2371. 419-534-2371. And one of our receptionists will be able to help you through the process. It doesn't matter what time. They should be able to help you through the process of registration or what you need for you to get into the program. So once again, go to the website, RMA,
That's Richard Medical Academy, LPN.com. So RMALPN.com, or you call the school on 419-534-2371. And before we conclude, I would like us to just talk about, students that are coming from different states. How easy it is to fly to Ohio. What's the airport of Ohio?
You can fly into Toledo airport.
Right.
They have an airport in Toledo.
Okay.
A metro, or you can fly into Detroit, DTW or something.
Okay.
Detroit airport, Detroit Metro Airport. You can fly into Detroit Metro Airport. And we can arrange for somebody to pick you up and bring you to Ohio.
Oh, that is so
It's just
wonderful.
about 45
Did you
minutes
hear
drive.
that? You get picked up like a VIP to the school. That is so amazing. So amazing. So flying to Toledo or Detroit, they can arrange a pickup for you to the school, and you get an orientation. Like what happens on the first day?
The first day, you get to meet the very first day that you arrive in the school. You get to meet the one of the directors of the school and the intake person. That's going to give you the process that we need. You must have talked to somebody over the phone, and after that, we should be able to orient you and tell you exactly what the school is all about. I will listen to you. Want to know what your needs are. Want to know where you're coming from. Want to know what might be some of the problems we might face down the road. So we start taking proactive steps to make sure that we are able to handle those for you. Together. And basically that's what we do. And we found a lot of success in what we're doing.
So the welfare of the student is very important.
Very important. Very important.
Because that will determine their success. So you start by, looking at any challenges they might have.
Do they need an apartment? Do they need house? Do they need a job? Do they need daycare for their kids? Whatever they might need, we will be able to help. Do they need financial aid, assistance? Do they need payment plans and all that good stuff? So we take care of all that for them. Richard Medical Academy is a dream come true to so many people that are trying to find a career in nursing.
That's right.
And we've had students from all over the United States call us to try and get into the program. We have students from Iowa, Houston, Detroit, Michigan, Redford, Michigan, all over the states. And when they come in, we're able to help them, orient them on what they need to do for them to become nurses and to be successful in life. We are a very small school and very family-oriented. So we treat you as family, and we make sure that your success is our success too. So we make sure the ultimate goal for you packing your things and coming to Ohio is for you to pass your NCLEX. We want to make sure that we can guarantee that you're going to make that NCLEX with you working with us.
That's wonderful. So once again, it's been a privilege and an honor to speak with you, Dr. Abunaw, on what you're doing, igniting success path for so many of our immigrant men and women here in the United States, helping to build their American dream. And it's amazing to know also the fact that your program is not going to be just once a year. It's actually, you're looking at 4 programs. So you don't have to wait till the end of the year to enroll for the following year. You can come in January, April, July, September. That's right. But you still have to do your full year. So the intake is 4 times a year, not just once a year. So many, many more students are going to be empowered. They're going to be successful. This is just amazing. Once again, you can go to the website to register or to get more information. It's RMALPN.com. Thank you, Dr. Abunaw, for coming to share this inspiration with our African community.
Right.
And also, I just want to say that, and to encourage everyone, it doesn't matter where you live in the United States. You could be from Georgia, from Maryland, from Texas. Ohio is just a flight away.
Right.
Right?
Right.
Just fly away to your success. Thank you once more.
Thank you. Thank you so much.
Thank you.
Yeah. Thank you.